My name is Adele Forrester, and I am the Chief Credentialing Officer at Pncb, and I oversee exam development for our 4 exams. And I'm sharing the stage tonight with Stephanie.
Hi, everyone. I'm Stephanie Boucher. I'm a certified pediatric nurse practitioner in primary care and the Associate Director of Credentialing Programs here at Pncb.
As we get started, we have a few housekeeping notes for you, and we'll cover these, but we are recording. We very much hope to be able to continue to share this information that we're going to do with you tonight, and so we are recording this webinar. You have all already been muted a lot. I see that I'm getting a message that I'm echoing. I'll try to talk more softly, perhaps. Thank you, though, for that message. We would ask that if you have questions along the way that you use the Q&A function. While there is a chat function, we will be redirecting anyone with questions to put them in the Q&A. And then we ask for your questions when you registered for this webinar, and we have done our best to work those questions into the presentation. But if there are any questions that are not addressed in the slides, we will do our best to answer them at the end, and would even be willing to stay over time just a little bit to interact with you. And then we will tell you more later about how to earn 1 contact hour, or how you will earn one contact hour for completing a survey that we'll send you. And neither Stephanie nor I have any financial disclosures to report.
So I'm going to share our learning objectives for tonight, and a little bit of an overview about what we'll be sharing here in this webinar. We're going to explain the Pediatric Mental Health Specialist exam, the Pmhs exam requirements and its benefits. We'll describe how the exam content outline supports your preparation, eligibility, and learning needs. And we'll identify resources and strategies to increase your confidence in developmental, behavioral, and mental health care, which you will see that we're going to be using the acronym Dbmh throughout this presentation to represent developmental, behavioral, and mental health. So, as I know you are all too aware, we are unfortunately amidst a pediatric mental health crisis. Mental health conditions were already on the rise as an ongoing issue in children and adolescents, of course, prior to the pandemic. However, since the onset of the pandemic in 2020, we have, of course, seen the incidence of developmental delays, anxiety, depression, suicide, and more increase amongst the pediatric population. The lack of access to mental health care certainly takes a toll on the children and the families that are affected by these conditions, but it also takes a toll on the providers who are caring for them. So it's likely that you are already taking care of these children, seeing them in your practices in primary care, whichever setting you work in. So why get Pmhs certified and take that extra step? Here are just a few of the reasons that we've heard from our certificants and others. First, it can increase your confidence and comfort level in caring for pediatric patients with Dbmh conditions in primary care. It also may increase the patient and family confidence in the care that you are providing for them. It can certainly reduce those, what we know are kind of awful wait times to get help, or for the child to get help. If you can comfortably evaluate, diagnose, and even treat those common developmental, behavioral, and mental health conditions in primary care, it really improves the access and allows for you to care for the whole child who's right there in front of you. By doing this, you actually can reduce the stigma as well of mental health. To be able to be treated in primary care rather than having to see psych or be referred out can really help reduce those barriers.
On this next slide, we have shared with you a quote from Jennifer Keller. Jennifer Keller is a friend of ours and a colleague and a volunteer. And I want you to note in this slide her mention of access to safe, timely, familiar, and cost-appropriate care. Working in the Philadelphia area, Jennifer describes how she recognized in her own practice, which was a large hospital practice with outpatient community clinics, she recognized that there were gaps in care for kids and that kids were falling through the cracks when they had these conditions. So as part of her DNP project, she decided to do research around that, developed a large collaborative network, learned that there were more resources in the community than she ever knew about, and then has gone on to benefit patients and families by earning the credential and starting appropriate care in the primary care setting. So we have some Pmhs updates for you. If you earn this certification, you will join over 690 people who currently have earned the credential and are actively practicing in a Pmhs role. There are other things that Pncb has done over the last year to look at this exam and the credential and how we can support it in new and different ways. And one of the steps we're taking over the next 3 years is moving the recertification, which had previously been a 3-year recertification, moving that to annual, which more closely aligns with other Pncb certifications and will probably make it a little bit easier for certificates to manage. We are also increasing access to certification. Prior to this, the exam was offered in 2 exam windows for specific reasons, and we are broadening the windows. There's going to be more testing windows, increasing that to 4 windows next year. This year, we have already launched a live remote proctoring option where you could take the exam at home in your pajamas or whatever if you'd like to, but there is a live remote proctor option, so you do not have to go to a brick and mortar testing center. And then we are also just completing some research to look at perhaps alternate eligibility pathways for this exam, trying to make sure that all eligible people can see themselves having access to the exam. So we'll report out to our stakeholder community on that before long. So PNPs and FNPs are the primary folks who seek to earn this credential. And we believe that there are benefits. We get this question often enough where people say, well, why should I do this? How's it going to benefit me? And we would say, kind of like Stephanie alluded to earlier, that it validates your knowledge, right? This is added specialty knowledge that you've gained on the job. So this validates with a national board certification that you really do know how to use this information and care for kids. It can demonstrate your commitment to serving children and teens, and of course increases timely access, and it can boost your confidence and thereby give confidence to your patients and families that you do know how to provide this care, that they can start care in their medical home. And then we've heard from other PMHSs that having the credential has really increased the respect that they feel from the community around them, particularly for folks in the rural setting where a PMHS might be the only person for miles around who is willing and able and not afraid to start this care for children. So the big question that always comes up is, wait, what's the difference between a psych mental health nurse practitioner and a PMHS? And so we want to clearly lay that out for you tonight. Because it is important that certificants and candidates understand the differences. So the Psych Mental Health NP is a scope of practice that has been defined by the APRN consensus model that was drafted and completed in 2008. And this credential certification is regulated by the state boards of nursing. Psych mental health nurse practitioners cannot practice unless they are licensed in that role and population. The psych mental health nurse practitioner is trained across the lifespan, so all ages, and they manage complex conditions. One of the examples that I often use is that schizophrenia, or caring for an adolescent perhaps with schizophrenia, is really outside the scope of the practice of a PMHS. However, a psych mental health nurse practitioner could hold, and we do have some that hold the Pmhs credential. And you might say, well, why have they done that? And again, from speaking with them, they have found that earning this added credential has reinforced for them that they really know the pediatric pieces. The pediatric developmental behavioral mental health is also woven together, that they really understand that piece, because they may not have spent much time with it in their academic program or clinical rotations. So flip to Pmhs, and this credential is and what we term an added specialty credential that is also consistent with the APR and consensus model. But if you've ever looked at that model and the pyramid that's described there, this credential sits at the top of the model as an added specialty. It is not linked to state board authority to practice. We do not report it to state boards of nursing, and there's no reason that the state would regulate it. The Pmhs most often can deal with the more common conditions, may occasionally engage with and recognize the complex conditions, but they typically would refer those conditions out to other providers, including psych, mental health nurse practitioners, psychiatrists, counselors, and a host of others. And then could a Pmhs also go back to school to a 2-year academic program and then take the board certification for psych, mental health, NP? Absolutely. They could do that. All right, let's take a few minutes and walk through the eligibility for the exam. So in the next few slides, we're going to cover the APRN license, certification, education, either continuing education or a graduate course, and then the all-important clinical practice hours. So one piece that folks need to understand about this added specialty credential is that the foundational APRN license and certification upon which it is founded must be maintained. So in order to apply for the exam, a candidate must hold current, active, unencumbered licensure at the APRN level in a US state, territory, or in Canada. Likewise, they must maintain the certification that originally made them eligible for the exam. This certification cannot lapse, right? Because I said that earlier, the Pmhs does not stand alone, the states don't regulate it. And if you, for example, are no longer a primary care PNP with Pmhs and your primary care lapses, then we would also be required to lapse your Pmhs certification, just as one example. So keeping the foundational licensure and certification are essential. And then another pillar that your certification was built on was having graduated from an accredited nursing master's or doctoral program or postmaster's certificate in one of these following concentrations. Please note that there is an exception on the previous slide real quickly for APRNs who were educated prior to 1992 when there was not a master's degree required to be a nurse practitioner. All right, we want you to know here that you have a choice, that part of the eligibility criteria is either continuing education hours over the last 5 years or completion of a graduate course, which someone may have done as an option that was a good one for them. So over the last 5 years, either 30 hours of pediatric specific developmental behavioral mental health, CE or CME, or this graduate course. And we would tell you that the most popular of these two options is absolutely earning the CE or CME. And then a tip that is we don't want to forget is using the exam content outline that can give you ideas for CE topics to search out as you're trying to complete CE that would add to your knowledge base. So practice hours, this is a big question for folks, like how do I get them and how do I decide how I've earned them and all of this. So we'll talk a little bit about that, but in the last 5 years, candidates prior to taking the exam or applying for the exam, candidates must have earned at least 2,000 clinical hours of pediatric developmental behavioral mental health clinical practice while holding an APRN license. And then this can be with or without a preceptor. It could literally represent your everyday ongoing care that you provide to children, adolescents, and young adults. On the Pncb website, we have put up there a very simple Excel tracking sheet as one tool to try to help folks conceptualize what this would mean. And it's just an Excel sheet that, for example, if you look at it, someone would list maybe a week in their work week, and then the practice setting that they were in, like, you know, were you in a developmental clinic? Were you in an outpatient clinic? What kind of setting were you in? How many hours you worked that week? And then think about the portion of those hours where you were engaged with children with conditions that were developmental, behavioral, and mental health, or probably more commonly, the developmental screening and surveillance that you do probably every day. All of those tasks contribute to the clinical practice hours that are eligible for eligibility for the exam. We've added a few sentences up here about what it could be: case finding, diagnosis, management, even consultation, you know, working with a preceptor. There's just many varieties and flavors of this. We realize the number of hours can fluctuate from week to week. And so again, this is very specific to each individual. Someone could have reached the 2,000 hours if they were just practicing for 1 year, but they worked in a very focused practice setting where there was a lot of maybe a developmental clinic, a developmental behavioral clinic, and that was really the crux of their day. So for someone else, it might take 4 or 5 years because they are working part-time and this care is only a portion of what they do every week. All right, now we're going to turn to the content outline and walk you through each domain of the outline. So the content outline is your essential study tool, also known by some as the test blueprint, and it describes all topics that are covered, and it lists how many questions per category, and it looks, and then you can use it to look for how your clinical hours align with these different domains. Are you making sure as you prepare for the exam that you have really done work or learning and gained knowledge in each area of the content outline? So where does it come from? Well, no one at Pncb just created this on their own. However, this is a big research study, and it's based on what we call National Job Task Analysis Research. We are required to do this research to have a national board certification exam, required to do this research every 3 to 7 years. And so on this time schedule, we reach out to current certificants and others who are doing the work and ask them which tasks are essential to practice, which ones must be covered on the exam to ensure that someone is competent, and then what's the frequency and how often you do them and how important the tasks are to good outcomes for patients. So everything on the content outline has been validated by research that Pncb has done and represents what PMHSs and other primary care or FNP, PNPs, FNPs are doing in practice on a daily basis. So our most recent job task analysis research was in 2021. It usually spans about 6 to 9 months of work. And we were very excited this last time to have nearly 1,000 respondents to a large survey. 36% of these respondents were FNPs. And this was a new thing for us. For the first time ever, we were able to reach out to the FNP community, identify those folks who are working with children or adolescents, the ones that are doing this care, and invite them to participate in the survey. So it really added quite a bit of depth to the survey. We also asked a question about the effect of the pandemic, right? This was such a big part of everyone's world. And we had 49 pages of write-in comments from survey respondents telling us what had been happening during this time. So another tip from the content outline would be to study all areas of the content outline to be successful on the exam. It's not going to be enough to study just one area of the content outline. So we would encourage you to study all areas. The exam tests your ability to apply the knowledge and then to use critical thinking. So on any given exam form, there are always questions at the recall, the application, or the analysis level, but each one is designed to identify folks who have the knowledge and then can use critical thinking to find the one best answer. These are the categories or the domains on the exam, and they range from number one is health promotion. And you'll see that this is the largest portion of the exam by just a point or two, but that makes sense, right? This is what folks in primary care are doing. They're trying to keep children healthy. And a second domain is evaluation of conditions. We'll talk more about that in a minute. Number three is diagnostic decision-making. Number four is the actual management of conditions. And then number five is just a few items about the professional role. We wanted you to know too that the exam is 150 multiple choice questions. And the exam you are allotted, or the candidate is allotted 2.5 hours to take the exam. And this time does not include any time that would be involved with a tutorial or anything getting used to the computer. But once the exam is started, it's 2.5 hours to complete it. So on to domain one. So domain one, I just want to highlight a few of the things here to familiarize you with the kinds of content that would be covered. If you note, there are two different subdomains, health promotion and anticipatory guidance. So this covers content about positive parenting, attachment, developmental progression, which most providers of children know very well. Guidance about individual temperament, educating families, caregivers about lifestyle modifications and risk avoidance, and educating also about the connection between physical and emotional health. Subdomain number two is the early identification and screening for Dbmh conditions, which applies to the things that I know many of you are already doing in practice. You're surveilling for kids at risk, and you're using evidence-based screening tools, and then the more focused risk-related tools. On to domain two. Domain two consists of evaluating the patient, getting that comprehensive history, which may even include a multi-generational family history, particularly of mental health conditions, thinking about health disparities for that child and family, social determinants of health, reviewing all this information, administering tools and assessments, and then of course, performing a physical exam and ordering any relevant diagnostic or laboratory tests. Domain three has several subdomains in it. It's interpretation of the findings, recognizing and differentiating the typical developmental stages and milestones versus those that are really abnormal that should prompt other investigation, recognizing genetic influences and early problems there, the impact of psychosocial conditions and factors, synthesizing all this information, and then absolutely using the DSM to document criteria and taxonomy for making decisions. So, and then engaging parents and families in your diagnostic impression, initiating referrals. And then I believe on the next slide, we move on to well, I'm sorry, maybe I was wrong. Maybe it's management that has all the subdomains, but okay, we'll move on to domain four here. Anyway, there's a lot of detail here, but I would imagine that most of you are already doing this if you're interested in the PMHS exam. So domain four is about management, and we have initial management, and then I know we'll move on in a minute to ongoing management, but initial management involves incorporating psychoeducation in the discussion of all of these things. And then you can move on to other information here, establishing treatment goals, documenting and obtaining informed consent and assent for treatment, providing counseling about the evidence-based strategies that will be used for this child and family, then also prescribing treatments, both farm treatments and other therapies and interventions, initiating referrals, initiating treatment while you're awaiting those services, and then directing patients and families to other community resources. It's just very rich here, the management domain. And then ongoing management represents ongoing support, monitoring, and counseling to maximize functioning for that child and family, where you're identifying any environmental factors that could be mitigated, assessing for high-risk behaviors, enhancing their family interactions, promoting academic functioning, and all of these other things listed here. Domain 4 also wraps up with evaluating treatment outcomes, identifying any new diagnoses that crop up or any comorbidities that are now more apparent, and then advocating for the child and family. I think of number 8 specifically because I remember the rich discussion from the Pmhs job task analysis group, as they talked about, no, it was necessary to include on the outline and survey something about concluding service appropriately so that you close out that relationship in a different way when appropriate. And then domain 5 is the last one with just a few questions here about knowledge and diversity of culture, maintaining confidentiality, some knowledge of state laws, federal laws. Please know that any questions in this area would be written and vetted and pre-tested to ensure that we are not just talking about one specific state. We recognize that states have different laws, and so we would be careful to do that. But ethical considerations, practice standards and guidelines, and then certainly documenting findings so that you and your practice are successful in reimbursement. So that's a quick journey across the content outline. The content outline also includes diagnoses, and where before there had been a long list of prioritized diagnoses, meaning the ones at the top were seen more often on the exam than those at the bottom, we were able to have some unique options with the most recent study, and we have been able to psychometrically arrange these a little differently. So we're going to move to show you the top 10 diagnoses, the middle 10, and then the last 9. So the top 10, I imagine all of you would recognize yourselves as seeing these things on a regular basis in primary care, right? They're common conditions in caring for children and adolescents. So these are the top 10 diagnoses, and absolutely of those 150 questions, there would be more questions on the exam in these top 10 diagnoses than anything else. The next section we've labeled some, because there will be some questions on these, and they include abuse and neglect, bipolar and related disorders. And so if you remember, I mentioned that this bipolar is perhaps a little, inching towards outside the scope of a Pmhs. And so if we write questions about that, it would probably be along the line of recognizing bipolar symptoms so that those can be referred or managed in a different way, but probably not diagnosing bipolar disorder. They would also include elimination disorders, feeding and eating, intellectual disabilities, and these other disorders and conditions that you can see here, including somatic symptoms and related disorders. And these continue on each of these 3 slides. These are continuing in a prioritized order. And on each slide, we've alphabetized each section as we go. So the very fewest diagnoses seen on the content outline would come from these conditions here: body dysmorphic disorder, gender dysphoria, genetic disorders, neonatal abstinence syndrome, neurosensory impairments, obsessive compulsive disorder, other neurodevelopmental disorders, substance use and addictions, and then finally tic disorders. Another important area on the content outline is pharmacologic management, right? As a as you know well, many of these conditions are treated in part with pharmacotherapy. So while we tested a longer list of pharm agents that could be used, these are the categories of agents that were validated by psychometric criteria as being fair to be included on the outline. So antidepressants, anti-anxiety medications, ADHD, disorder meds, over-the-counters, sleep medications like melatonin, supplements, antipsychotic medications further down that is often used for autism, and anti-epileptic medications. So other management is, right, not everything is pharm, and outcomes are often best when pharmacology is paired with other therapies perhaps. And so these are the types of therapies and interventions that are also covered on the exam in a prioritized list, meaning you might have more questions on the exam about diet and nutritional approaches than you would about cognitive behavioral techniques. So this list is organized in that way as well. And then last but not least are the screening and assessment tools. And so again, while Pncb surveyed and tested a longer list of survey tools, we'll show you the ones that actually met validation criteria. The exam will include, but not be limited to these exact tools, but these are the ones that are most prevalent. So they're divided into universal screening tools. And again, I would imagine that most of you recognize each one of these and are already using them in practice, but these are fair game, if you will, for testing on the exam. The risk-related tools include Vanderbilt assessment scales, generalized anxiety disorder or the GAD-7, the SCARED tool, the Beck depression inventory, the Conners scales for ADHD, and then the child behavior checklist. All right, I'm going to pass this off for a moment to Stephanie as she talks about ideas for increasing your confidence and practice in testing.
Thank you. All right. So yes, increasing confidence. I'm going to talk a little bit about preparedness and how to be confident, both in practice and for your Pmhs exam. We certainly do get some feedback from from certificants that hold the Pmhs that their certification, the training they've gone through, does give that extra boost of confidence. I certainly know from personal experience in practice that it can be intimidating to approach the care for these children. We want to do a good job and do the best we can. So that's this confidence, certainly we get feedback that it comes along with certification. So we've talked through the content outline. Adele gave you a great run through there and all the things that you need to know for this exam and what you might need to be eligible. So I'm going to help you figure out all the resources available that are there to help you confidently prepare to care for children with Dbmh conditions and of course to be eligible for the exam. There are a number of training possibilities out there. They come in many different shapes and sizes. It really can meet whatever your individual needs or your goals are. For example, I'll start from the top of this list here. Perhaps you do need more clinical experience, or you're feeling like your patients, what you're doing in clinical practice maybe isn't meeting the needs for eligibility, or you just want to see more about how a Pmhs practices. Maybe you know a colleague who specializes in this area, is passionate about it, or maybe you know someone who is a Pmhs and you could shadow them. That certainly is helpful. Adele mentioned developmental, behavioral, mental health continuing education before, and that can be, there's many choices out there. You can seek them out. You can use that content outline to sort of guide CE topics. That would be anything that's on the content outline. If it's a topic there, it would certainly be eligible and count for your CE here. As I move forward down the list, I'm not going to get into too much detail about these programs. There are a couple on the next slide that I will get into, but these are some that we know of that are out there, not an endorsement for any of them, but again, just to give you a view into some of the things that are available. So we have the, so there's the American Academy of Pediatrics. Of course, they have the PrEP, Developmental Behavioral Peds and Equip modules. The APRN Scholars Program at Almost Home Kids, I will give you a little detail about in a moment, as well as the Duke Pediatric Behavioral and Mental Health Specialty Program and the KISS Online Mental Health Fellowship from Ohio State. There's also the Reach Institute Patient-Centered Mental Health in primary care and pediatric primary care, and the ECHO Autism Program from UC Davis. So I would encourage you to, see what your needs are and you choose whichever one seems right for you. There's not really a prescription, that we would say you go out and do this and that's the best thing. It's gonna, really be tailored to you and you have to choose that a little bit more. So as promised, here's a little bit of a detail about a couple of these programs. Again, not any one is the best, just try to meet your needs and what you need. So we have the KISS program. Dr. Lusk is the head of that. So that is a self-paced CE course, well, CE or academic credit actually. That's self-paced, it's online, and it's just, it seems is certainly a program that would expand your knowledge base and count towards your eligibility for the exam, as well as the Duke Fellowship program, also great, and an 8-credit course that you can see it outlined there, 12 weeks, and a clinical rotation for that one. And then lastly, first, just a little more detail on this, the Almost Home Kids APRN Scholars Program. That's a 50-week training program, 2 days per week. That actually includes the KISS program in it. So again, you can see 3 great different programs, some detail there, certainly look into them more on your own, but they all apply toward the eligibility for the Pmhs exam. So certainly, as you are considering any of these options, we encourage you to advocate for employer support. As you're advocating for yourself, your patients, it will really help to have your employer fully invested in your journey, realizing that it will benefit not only you and your patients, but the practice as a whole. And we've talked in depth about how to use the content outline to study. So as it shows on this slide, the content outline can also be a tool that can sort of demonstrate what you can do in practice. Some employers might not realize what a Pmhs, affords you in the practice, what it allows you to do and that validated knowledge that you have. So use that content outline to show what you can do in practice, demonstrate those as like deliverables to your employer, ways that you can improve patient care. Some employers may even be willing to cover costs related to your training. Certainly it would help to have them invested so that, there's a little more time you may need to spend here. But even might buy textbooks to have on your practice bookshelf as a reference for those in the moment questions that come up that benefits not only you, but really any providers in the practice. I know it's always nice to have a pediatric psychopharm reference nearby. Sometimes the textbook gives you answers that, Lexicon or some other, resource tool might not have if it's just a drug lookup tool. And so on this slide, I'm going to discuss the NAPNAP, the resources that NAPNAP has available. I know many of you may be NAPNAP members, so we just wanted to take a moment to discuss those resources. Special interest groups, SIGs, as many of you may know them, are a great way to access colleagues who have similar passions and clinical subspecialties, and to share resources. The 4 listed here are the ones that we have selected out as the most relevant to Pmhs: developmental, behavioral, and mental health, of course, that's SIG, adolescent healthcare, school-based healthcare, and children in disasters. NAPNAP also, we want to point out, does have a Pmhs review course. Pncb doesn't endorse any review course for our certification exams, but this is actually the only one that we know of at this point in time as a Pmhs review course. That being said, some people who are not even taking the Pmhs exam or are already Pmhs take this review course as a resource just to add to their knowledge base. And lastly, I certainly want to make sure you're all aware of the resources that we have here at PNCB to prepare you for your exam and walk you through this journey. So in addition to the content outline, as we've said, should be the real, go-to, we provide the things listed here. So we have well, let me backtrack a second. The PMHS exam resources are all on a web page on our PNCB website, which we'll have linked out for here on the coming slides. Part of what you'll find there is this readiness checklist. Consider it a roadmap from the eligibility to test day. I would, maybe even print this out, pin it up, have it somewhere so you can check things off as you go along, and make sure that you're doing all the things that you should do to be prepared. It's really just a great step-by-step guide. We're walking through all of that pretty much here today, but just so you have it on the side. The reference list of textbooks is pretty much what we're talking about here. So we always say consider to have 1 or 2 textbooks. You don't have to have every textbook on the list, but we certainly 1 or 2 key references, including one about pediatric psychopharmacology. The references, all of our exam items must be referenced from a resource. And so PMHS exam writers and committee members these are the texts that they have found most useful. And clinical practice resources, certainly we can't forget about those. What we base a lot of our work on: evidence-based practice guidelines, statements, reports, continuing education, programs, and conferences. And we have some of that listed out on our webpage as well for you. And then, of course, maybe you don't know, we have a practice test for the PMHS exam, a Pncb practice test. So certainly, if you're going to sit for this exam, I highly, highly recommend taking the practice test. It's just one module that we have at this point in time. It's 50 questions. And these questions are written in Pncb style by PMHS subject matter experts. So really can be helpful in your preparation to take our practice test. And there also are sample questions, I would add, just before we get to our any questions. There are sample questions on our website too, even if you don't take the full-on practice test, or in addition to the practice test. So, and certainly you can always reach out to us if you do have any sort of other questions. But I'm going to pass it back over to Adele for some frequently asked questions, and we'll also be taking questions. I've seen a few come through the Q&A already, and we are going to try, like Adele had said before, to get to any questions that you guys have.
All right, well, let's address some of these because we certainly want to answer them now or later for you. But one question that we often get is, will earning this credential change my scope of practice? And the answer is absolutely no. I remember someone writing a few years ago to ask if it would now enable them to do med management for adult psychiatric patients. And it was like, no, there's nothing else about your academic preparation or certification that is about adults. So no, this credential does not change your underlying foundational scope of practice. Will it change your prescriptive authority? Probably not, because it does not enlarge your scope of practice, and because as an F&P, PNP, you already have prescriptive authority, hopefully in your state, to prescribe the medications that are indicated. But we'll say a little bit more about medications in a minute, I believe. And then, will it change your ability to code or reimburse? And let me just mention here too, as part of this whole picture of the whole slide, that when we did our most recent job task analysis that I mentioned earlier, I looked back and 55% of PMHSs were working in primary care, and 8.6% were working in developmental behavioral mental health clinics. So as you see, many of them were making this work for them and providing care in primary care and in other settings, we recognize. So to the coding piece on that same job task analysis research, of those who answered the survey, 52% were using medical codes only for billing and reimbursement. 46.5% were using both medical and mental health codes, depending on the patient, while only 2% of respondents were using mental health codes only. So the take-home point here is that many, if not most, PMHSs are being very successful with coding and reimbursement for their practice or themselves by using time-based primary care codes. And our research also showed that certificants were the complexity levels of the patients that they were seeing most often with these conditions were at complexity level 3 and 4. So, is someone required to shadow or get a preceptor? Absolutely not. Nope. But we mention it because it's a great way to add to your knowledge base, right? Shadowing someone, reviewing cases, getting a preceptor for even a portion of your preparation would sure go a long way, I would think, to adding to your knowledge base and having someone to talk with about the conditions. For this credential, are you required to return to school? And the answer is no. Again, because this is an added specialty credential, it is meant to recognize the knowledge and skills that you have gained on the job in practice over time. It's different. If you wanted to earn the Psych mental health nurse practitioner credential, you would have to return to school for what is probably a 2-year academic program and then sit for national board certification with a different certification board. So returning to school for PMHS is a no. Again, that being said, you absolutely might return to school to just add to your knowledge base or earn continuing education or get that graduate credit. Are you required to submit evidence of practice hours? And the answer is yes, maybe, probably. And I say it that way because when you apply, you are not required to submit the evidence right at that moment. However, if your application is audited by Pncb, which we are required to audit a certain percentage of them, then you would be required to submit the evidence. And that goes back to somehow tracking your clinical practice hours, like how over the last number of years did you earn this expertise. So we would strongly encourage you to begin to keep a record of these practice hours in case you are required to submit that. More tips for you. When we talk about shadowing or exchanging knowledge, think about the things that you are strong in, the things that you're comfortable with about providing patient care, and then things that perhaps someone else does in a different way and they're confident in this arena. So consider even setting up some kind of a shadowing exchange where the two of you share your knowledge base. We think that would be a great idea for preparation. What if you don't prescribe? So looking back to our job task analysis research, we would tell you that about 64% of respondents independently prescribe. And I assume that they mean by that answer that they prescribe Schedule II medications, which are most of the ADHD medications. So, and we know from research with the beta exam about a decade ago that those who were most successful on the exam did have prescriptive authority and did write prescriptions for these medications. So as you can imagine, you're going to have a different frame of reference coming into the exam. If you prescribe the medications, you're familiar with the concepts or the contraindications or those kinds of things, much more familiar than if you don't do that. So that being said, if you don't prescribe, then I think it would be important for you to put yourself in at least a mindset where you could imagine doing that and think through the knowledge that you would need to know. Another little factoid from our research too was that 82.4% of respondents actually have a DEA number, which I believe in most states is required to prescribe Schedule II medications. So developmental and mental health concerns. To these next two questions, what if you only work in or see certain kinds of conditions every week? And it's not a problem in terms of clinical practice hours, but we would guide you back to the content outline because you're going to be tested on numerous conditions from that clinical problem list and according to those tasks. And so perhaps if you're only seeing developmental concerns in practice, that you need to widen your knowledge base about adolescent conditions or depression or anxiety, something that you normally don't do. Because again, the exam is testing content from all 4 domains. We had a question from an attendee who I was hopefully attending tonight that wanted to know about the impact of restricted clinical hours during the pandemic. And we recognized that this was the case. Certainly if you had telehealth hours, it would not matter from our requirement if your clinical practice hours were done via telehealth or in person. So that's not a problem. However, the impact of the pandemic and restricted hours in general does not change our requirement for clinical practice hours. The clinical practice hours for us are a requirement that we have put in place that we are now accountable for with our accrediting body, the one that accredits the exam. And so we cannot make changes to eligibility criteria without thoughtful research and stakeholder input and a rationale for that. Other people have questions. We get this questions a lot about acute care nurse practitioners. Are they eligible for the exam? The exam was originally grounded and conceived and developed for primary care because at that time, 10, 12 years ago, that's where the preponderance of kids were being seen in primary care with these conditions. So it was thought to be a primary care credential. We absolutely recognize that those same children will end up in hospitals or acute care settings for different reasons. But currently acute care candidates are not eligible, and we have just completed some research to help us relook at this idea, and we will be reporting out those results before long to the acute care stakeholder community. Does working in palliative care make you eligible for the certification? And so, again, I would say yes. Your hours, if you are providing developmental, behavioral, mental health care to patients with palliative care, conditions, that would all be fine. But I would challenge you to go back and look at the content outline, because at least from, it might be hard to conceive that someone in palliative care is using all the same screening tools, all the same risk-related tools to evaluate children, or prescribing the same kind of medications. So the clinical practice is not a problem as long as someone holds primary care certification and they are really covering all tasks in the content outline that would make them successful. And the practice settings, which ones are allowed for clinical hours? So those could be quite varied. They could be precepting with a psychiatrist. They could be hours spent in primary care. They could be in a developmental clinic, just a host of different practice settings. So we are working with candidates to be flexible and generous in our interpretation about clinical practice hours, because we know that your work is done in such a variety of different settings. Stephanie already answered the other question. I'm sorry, the first question here, is the NAPNAP review course the only one available? And to our knowledge, it currently is the only entity that is entitled a review course. Let me skip to the third one, the telehealth billing, coverage, and liability. So I imagine maybe this person was asking for advice about telehealth and billing and liability. And I would have to say that Pncb does not really have the answers here. We know that from what we hear, that nurse practitioners, in order to provide telehealth, a nurse practitioner must, hold a state license in the state where the patient is residing at the time of the visit. So someone doing telehealth. I'm thinking one of our board members who does telehealth, and she has multiple licenses in different states, but because it's required for her to do that. But beyond that, I would direct you back to your practice to ask questions about billing, or your risk management company, malpractice company, about the liability. And then to the question of how long should I study? So this is, again, a question that would just be very hard for us to answer, because it is so different for each person. For someone who has spent 10, 15 years in practice and they've done this kind of care over time, and they really feel like they've gained some expertise, they might look at the content outline and say, yeah, I'm pretty comfortable with that. Or they might take a review course or a Pncb practice test and feel very solid about the knowledge. Someone else, on the other hand, might engage with those same activities, review course or continuing education, and think, I don't know, I need to get some more knowledge here. So I'm sorry, we just can't guide you too much about how long you should study. All right, well, I think we've managed our time pretty well. It's 8:59, and I know Stephanie has mentioned a few more questions in the Q&A section, which we would be happy to answer, and stay with you for whatever time it takes to finish those questions.
Yeah, I'm going to go ahead and read some of the ones that we have in the Q&A already. If they were already covered, I know we have one or two that I think Adele already touched on. I'll leave those be, but let's try to address some of the fresh questions coming in. So we have, do the hours worked have to be an advanced practice role, or can they be worked in an RN role?
The hours must be worked in an APRN role currently. They must be worked in an APRN role because it's an added specialty credential, and the RN and the APRN role are different, right? As an APRN, you are diagnosing in a different way and prescribing. So your clinical knowledge has to be built on your ability to function as an APRN.
Okay, and how are pediatric practices recognizing a PNP with a Pmhs certification?
Gosh, I can think of several examples. I wish the whole team was on the line here, but maybe one of the most unique ones, I had an employer write to us, maybe a couple of employers write to us and say, I have 3 nurse practitioners who've just earned this credential, and we are so proud of them, and they're going to do great things for our foster care team, or maybe it was their child abuse team or something, and we want to reward them and increase their pay. which right is a great question to ask. So we shared any information that we had in that regard. They're recognizing that way. They are putting their names and credentials on the website. They are doing press releases about this, and really increasing people's awareness of who is in this practice and the credentials that they bring to the table. They are also recognizing them by supporting them. I'm thinking of another person I talked with who, because she laid out a case with her employer for earning the credential, the practice is going to pay both for her preparation and then for her taking the exam. So she felt like it was leveraged there. I know in the future we are going to share some of the salary questions that we ask as part of our job task analysis, and we can share more then with you about how people are either feel rewarded by things that are happening in their world, or they are financially being rewarded in certain ways for the credential. Probably one of the best examples I can think of, though, that's just makes me smile every time I think of it. It's Pmhs in the Pittsburgh area who are making a difference in their community. Excuse me, this makes me choke up sometimes because of the hard work that I know you all are doing. And they have gotten a team of kids patients and nurse practitioners who are really in primary care. They are carving out a role for themselves in the practice. They are taking care of all the patients with behavioral and mental health conditions and creating collaborative relationships in the community. And they are financially adding success to the practice because of what they're doing. So they are really supporting children's and patients and families in this regard.
That's a wonderful answer. Thank you so much, Adele, for that, all that information. I'm sure that's helpful for everybody to hear. You want to feel validated, right, when you do these big things in our careers. So moving on to the next one, does this certification give us the ability to diagnose autism spectrum disorder?
So this question has come up, and I can share with you what I have heard discussed by PMHSs is it probably depends upon your insurance carrier and what's happening in your community. Some states, some carriers will allow nurse practitioners to diagnose for autism. Others have run into barriers in their specific location, and they have been told that you can only diagnose autism if you have the ADOS credential, right? Or not credential, but if you've been trained in the ADOS tool. Autism Diagnostic Observation Scale, I believe that's the name of it, ADOS. But however, I have heard, and I know that nurse practitioners can be trained to use the ADOS scale. So that is not a barrier. You can be trained to use it. Now, whether or not you need to have that training is another question that has to be answered more locally.
Yeah, and yeah, those state-to-state guidelines you may have to look in on your own, and that applies to this next question as well, actually from the same person. Will this certification give me the ability to prescribe ADHD meds in Florida? Here you have the ability to prescribe controlled meds, but not psych currently, unless you have a mental health credential.
So from all I know, Florida is a difficult state for nurse practitioners to be able to prescribe. And we have heard from others that there is the barrier that you mentioned. So it will probably rely on the individual insurance carrier that is giving reimbursement as to whether or not they would use the Pmhs credential as a mental health credential. That being said, perhaps they don't know about this credential. In fact, many insurers don't yet know perhaps about it, and Pncb would be happy to work with you and write a letter of information or support about the credential itself to the insurance carrier. We have done that in the past on several occasions, trying to advocate for PMHSs, but I can't say for certain that holding the credential will individually change your situation in Florida because, right, your prescriptive authority is regulated by your state board of nursing.
All right, here's a question about billing codes, which I think Adele already covered for you. Is there a fee to take the 50-question practice test?
Yes, there is a small fee, and I'm maybe Lorianne can help us with the price. Is it? I don't want to misquote.
It's $35.
$35. Okay, $35 for 50 questions. The questions come with a rationale statement for each one or paragraphs that would walk you through a little bit about why the key is correct and why other answers are possibly wrong.
And we do sometimes that, you can look for promotions. Sometimes we do have those. So keep your eyes peeled. Okay, so next question. Do we have to seek insurance credentialing to use behavioral health codes?
Insurance credentialing to use. So if I understand the question correctly, you're referring to the fact that some insurance carriers have requirements for use the mental health codes. So I would say from all I know, you do not have to seek credentialing from the insurance carrier, but rather when you go to use those codes, you may be approved or denied in using those codes. Would you agree with me, Stephanie, that that's how it works? But you don't automatically have to get approved. You just engage with that coding and see what happens and work with the billing staff in your practice.
Right. Yeah, I would agree with that. Okay, so will mental health job needs be met certified pediatric nurse practitioner with a Pmhs certification? Sorry, I'm not sure. Did you get that question, Adele? Do you not?
I'm not sure I understand it.
I'm
And let
not
me just
sure.
throw in here too that we'll mention this in the very end, but for any questions that we can't really understand or answer tonight, we absolutely would be love to talk with you later by contacting us, but we'll give you that information.
Yeah, someone did ask if we can access the recording later. Yes, we will have this recorded and available later on. Just to continue to try to get to, there's a few more, I think that's all we have time to cover, right?
Yeah.
I'm in pediatric sleep medicine. Would I be eligible? I think you kind of covered that already, but if you want
to. That's another example, like the palliative care example, where if you're in a very focused area of practice, you're not limited by that, but I would challenge you to look at the content outline and see if in sleep medicine you are doing or you have knowledge of all the tasks on the content outline. I can give you one example that often comes up, and we have Pmhs who have ended up working in a neurology clinic. So they're working a specialty clinic. However, the credential benefits them because children that they see with headaches or other conditions often have underlying behavioral mental health conditions. And so they are able to recognize that, use the screening tools, and begin to start care because they're in neurology. So I think you kind of need to think about the real fine detailed specialties like sleep medicine or palliative care and just compare your practice to what's on the content outline.
Yep, I agree with that. All right, so can you use your Pncb CME hours for your PNP primary care and your Pmhs certification requirement for renewals?
That is an important question. I'm so glad you asked, because Pncb allows you to quote unquote double dip at time of research. So if you hold both credentials and you have done your excuse me, your continuing education hours, if that's what you're opting to do, if you've done them to meet your Pmhs requirements, they also count for your PNP requirements. So yes.
Yeah, thanks for asking that. That's great. I did a 1-year LEND fellowship years ago, leadership and neurodevelopment. It did as much affect my practice, but did enhance my knowledge. Okay, so less of a question, but just a comment there. Let's see. Some commentary here. I'm just working through. I am a PNP earning my MAPS certification, Medical Academy of Pediatric Special Needs, over the last 5 years. Includes mainly autism, developmental disorders. Will I be able to use my MedMaps conference hours, which is from classes and testings in these areas every year, and my training towards my 2,000 hours?
From the short description that you have given, I would probably say yes, but we would love to look at more of your an outline or description of what you're talking about, so we could go to the website. But it sounds great. In fact, we'd like to know, I've never heard of that particular course, so we would like to hear more about it, and maybe it's one that we should begin to list as a resource for Pmhs.
Absolutely. Will we be able to qualify for psychiatric NP positions if we are exclusively seeing a pediatric population?
I would say probably not, but again, I would advise you to look at the job description. For example, just in the last month, I've had an employer write to say, we've had a Pmhs apply for our inpatient psychiatric unit. right? And so inpatient psychiatric care really implies complex conditions that have required special inpatient care, and they're not the common ADHD, depression, anxiety. So my reply to her was probably not, depending on the job description that you have, because back to the underlying credential and foundation is that the primary care credential did not prepare someone by academic training, certification, and licensure to work inpatient doing psychiatric care with complex conditions. So the answer is probably no to that. It does not prepare you for a mental health job. That being said, I can think of other examples where a Pmhs has been hired by a psychiatrist to work alongside the person and do more of the common, less complex conditions so that the psychiatrist can see the more complex conditions. So it sounds to me in that instance where they've got good role definition about what the Pmh is going to do, and it's been made clear to the Pmhs and everyone else that Pmh is not going to see the adult patients. So, you know, it kind of depends a little bit more on what you're at, you know, what the situation is. But again, we'd be happy to just talk more about it with you offline.
Right. This is a good question. Can your office colleagues refer their patients to you for management, or should you manage only your own patients?
Two thoughts come to mind. If you mean colleagues outside your practice referring to you, I don't see why not. But again, I'm not quite sure. That might be a good question for the Pmh listserv that we have for folks. Or if you mean seeing some patient who's already established patient.
She said your office colleagues. So I take that as, yeah, you're within your practice.
I guess the rub comes as to whether or not you're probably implying the rub with the referral piece for insurance and billing, and I don't know the fine details of that. Unless Stephanie, do you have any suggestions there?
I don't on that note, that last comment that you made, just the true referral piece of it. But I would, you know, certainly as like an unofficial referral, like I'm not comfortable seeing these patients. You know, I think that you need some help from one of my colleagues who really does a great job taking care of these patients, has a pediatric mental health certification. I absolutely, in that unofficial way, certainly. It doesn't have to be just your own panel of patients. I know a lot of places you have your own panel, but sometimes, yeah, there's somebody within the practice that you refer to, who is a Pmhs. Yeah, that absolutely we see happen. All right, so next question. Someone mentioned the LEND training before. I'm wondering if the LEND training will count towards training hours. I did the fellowship during the 2020-21 school year.
So we are in the process. We have the LEND program on our list of programs that we need to explore a little bit further and have a conversation with the people that run the program just to make sure we understand what it covers, to make sure that it is comprehensive enough that we think it would really help prepare candidates. But it sounds like you've benefited from it. So we can keep you posted on that, or please check back with us.
I think we have a few more. We're getting towards the end here. I worked 5 years as a PNP in primary care, just transitioned to management role 12 months ago. Will all 5 years of my hours count?
The 5 years will count if they are within the 5 years. Well, two thoughts. The 5 years will count by length of time if they are no more than 5 years from the date that you apply for the exam. Now, will the whole 5 years in primary care count? Probably not, because not every patient that you saw was a patient with developmental, behavioral, and mental health conditions, concerns, screening, or whatever. You know, for a lot of the sick visits with conjunctivitis and ear infection, those would not count towards clinical practice hours. toward eligibility for this exam.
Right, and so that's a great lead into this question, and pretty much answers it. How should I calculate practice hours as a PCP at a private practice? Can I include all work hours, or should I calculate specific hours for developmental, behavioral, and mental health care?
This was covered a little early on in the presentation in case you joined us late, but you may want to go back and listen to the recording and review the Excel sheet that we have created that would help guide you on how to begin to think about separating that time. I know there was another question I think I saw about do the practice hours have to be measured by week? And no, absolutely not. They don't have to be measured by every week, but that just seemed to us like a digestible unit of time. You know, rather than keep track of them daily, you could keep track of them by the week. But just know that in the end, if you were audited or we needed to see evidence of your clinical practice hours, we would need to see enough detail that it's obvious to us how you obtained your eligibility.
Yeah. Great. For my own clarification, I completed the developmental and behavioral modules on the Pncb site for current recertification cycle. I also work in a developmental behavioral clinic. All of that would count towards clinical practice experience, correct?
So working in the developmental behavioral clinic would be clinical practice hours, but not completing the modules. But the modules would count toward your CE credit, if I understood the question correctly. Right, your clinical hours are your hours engaging with patients.
Right.
Not the hours completing the module.
Okay. Those Pncb developmental modules are great, by the way, very relevant to what I see in clinic. Oh, that's just good feedback. Thanks for sharing that.
we work really hard on those and try to find good resources. So.
Absolutely. As a certified PNP, primary care, APRN, autonomous, I would like to challenge the state of Florida to allow me to prescribe ADHD meds. Would the Pncb be able to help in the fight to help these kids?
I'm sure that we would be willing to add a letter, you know, of advocacy for this. However, from all I know, your prescriptive authority has to go through legislative changes or regulatory changes at the Board of Nursing. And I'm pretty confident that a Board of Nursing is not going to make an exception for one person or a small group of people because we wrote a letter for you. So I think it would be a combination of advocacy at your state level with your membership organizations, NAPNAP chapter, other statewide NP organizations to enlarge it and change it for the whole group. But please let us know if we can help with the letter.
All right, we've had a couple new ones come in. So regarding contact hours, I work as the primary care provider in a residential treatment center, all adolescent psychiatric patients. Will all of those hours count?
Read that description for me one more time.
Sure. I work as the primary care provider in a residential treatment center, all adolescent psychiatric patients. Will all of those hours count?
You see, that's another unique setting where someone has found themselves. If you are working at the APRN level doing your, I guess, intake assessments and other things, what was the word that was used in primary care provider, taking care of their primary care conditions, right? Then yes, without any deep thought, that sounds like it would be appropriate. It's a different primary, it's a different setting than a typical primary care office, but I'm going to hesitantly say yes. We may want more information from you later.
All right, when will be the next opportunity to test?
The next window is, I believe we have a current window going on right now in June. And I
Yes.
believe the next window, maybe get Lorianne to back me up here, is September. I don't have that schedule memorized, but
I unfortunately did not memorize that either. I know we're in the June testing window right now.
they're on the website. There were 3 windows this year, so.
Yep. Oh, correct. Yes, we are correct. Okay.
You are correct. Okay, thank you very much. September.
And then
And you'll want to come to the I'm sorry, September and then November. So 2 more windows this year. And then there is a period several days out before that window when the application will close and we no longer take applications because of our need to process them.
Right. And this that Pncb exam resources page that I was talking about before, in case anybody happened to miss that, I know it was towards the end, but all of this is published there as well. The testing windows, you know, when to apply, application deadlines, so all of that stuff is there. Okay, they keep rolling in, Adele, so we'll keep answering, right?
Yeah, we're good.
The FNP would need a post-grad certificate in psych mental health NP, so this can occur?
No, not at all. FNPs are currently eligible for the exam because FNPs have a primary care scope of practice that includes children and adolescents, you know, the pediatric age ranges. So you're already seeing those kids in primary care. And at the beginning of the presentation, there were a few slides about eligibility, but you do not go back to school for the Pmhs exam.
Is the test discounted for DNP students?
I'm sorry, I missed your question. Or is
the exam discounted for DNP students?
Oh, currently it is not. That may be something that we can consider in the future, but I appreciate the question.
Can you explain no pay till you pass? I think probably so.
Sure. I can't explain it as other folks on our team, but basically it's an agreement. No pass, no pay is an agreement that Pncb has established with probably over 200 different hospitals that allows candidates at their hospital, usually for the voluntary certifications like certified pediatric nurse, to take the exam with no risk. The hospital is not charged to pay for the exam until the candidate is successful in passing, according to a certain number of attempts. So it's an agreement that we have currently for the CPN exam, and we can talk more, or you could write us again about Pmhs and inclusion of that.
And Pmhs does have one free retest.
Mm-hmm. That's true. Thank you.
Just wanted to add that in there too.
Yeah.
Okay, and I think unless anybody sends another one in, the last question is, are PAs in primary care eligible?
So thank you for asking this question, because a part of our thinking broadly about how to support this credential and encourage more people to use it and get it, we have tried to think about and explore whether PAs could be eligible. Currently, they are not eligible. Currently, this is a certification for nursing professionals. I know that PAs actually have some kind of added specialty qualification in behavioral mental health of their own, that their own certification board offers. And I don't know that that added specialty qualification for PAs is specific to pediatrics, but currently they are not eligible. But stay tuned for other groups of folks that we would love to include.
All right, I think that's everything.
Okay. Well, let's go to our last slide, where we've left you with a beautiful quote from a good Pmhs friend of ours, Avis Johnson-Smith, and what she's done with care by using the Pmhs credential. So we appreciate all that you're doing for children and families, and we would ask you to look for an email tomorrow where we will ask you to give us feedback about how we did tonight, and also answer any questions that could lead you to earning continuing education credit for the webinar. So again, we appreciate your attention. It's been fun to engage with you in this way, and we're here for you with any questions. Find the email there at the bottom, email exam@Pncb so we can help. Good night, everyone.
Good night.